All right, we'll start at 7.7, right? Here we go. Consideration of the agreement between County of Lake and Community Behavioral Health for substance use disorder medication-assisted treatment services for fiscal year 2025-26 in the amount of $1 million. Director Jones.
Yes, thank you so much, Mr. Chair, Board. I'm actually delighted to bring this agreement forward because it represents a significant step forward in implementing our organized drug Medi-Cal delivery system. We do not have any MAT, medication-assisted treatment programs, very few in Lake County, not enough. And so we're just delighted and thrilled that we now have one in-house. And we are initially started with our own clients just to get a good workflow, and we are expanding that so our contracted providers clients have access, and hope to continue to expand MAT access in the community.
Supervisor Sabatier.
So I struggle with this item. I believe, and just a quick question for Director Jones, we already have a relationship with Community Behavioral Health, and that's for mental health services. This is a different one for substance use, or is this a new contract for what was already started in the first place?
To clarify, we have had a long-time relationship with Community Behavioral Health that started, I want to say, fiscal year 21, 22, 22, 23, where we issued a request for proposals for our specialty mental health services for psychiatry and nursing staff, and they've been filling those FTE needs for some time, and now this is a newer relationship with them to provide staffing for MAT, so specifically prescriber and nursing staff.
And I appreciate that. And so in the previous iteration of the relationship with the contract that we have for specialty mental health services, I know I approved it, but I reviewed the contract again and again, and it's just, it brings concerns, not about the services, not about the need. That's where I'm conflicted. They're using our facilities. I don't see any kind of lease agreement or any kind of agreement on how that functions. Are we paying for janitorial? Are we paying for electricity? But the cost of each of the services are very high as well. I don't know, because obviously this is a compounded cost rate that applies for all of the above that they pay for. It's not just the individuals that do the services, but we're looking at, and I'm going off the top of my head here, like $250 for LVN, over $400 for nursing per hour, and over $1,000 for medical doctor stuff. Some of it is stuff that is possibly able for us to hire from within, and it doesn't meet anywhere close to what our rates are for that staffing. I'd love to, I feel the need to say that today I can't support this, because I feel we need to have a conversation with our union about their feedback on this. I'd love to see a lease agreement to better understand what are we paying for this, other than the services themselves, because they're using our facilities. I just have some concerns about also adding new services at this moment in time. Yes, it's needed, but for something that we're already struggling with the payment system, in the sense of there's still an outstanding loan currently. And adding more services in a atmosphere of complete unknown as to what's going to happen with Medicaid and how that's going to come down and impact us. And so I just, today for this one, very conflicted about it, but I just don't know that I can support this.
May I respond?
Yes, please.
Thank you. So a few points of clarification. It is true, those are the rates of service. Those are billed fee for service. So when a service is delivered, they bill us 65% of the rate. So the rates reflected on that sheet are not 100% of the rate. We retain 35% of that rate for administrative burden and costs. It takes a lot to make the machine run from the back end. We had historically utilized our admin percentage of that, if you want to call it, that we retain to support all of our facilities. And now I'm happy to work, and I'll be following up with administration and council regarding potential of a lease agreement for them to utilize our facilities. But I want to clarify that those are the Medicaid rates, so that means that those are fully Medicaid reimbursable services. To date, Medicaid continues to flow. We are not seeing any impacts to the Medicaid system, and we don't anticipate that. And I also would like to clarify that the short-term, now the definition of that we can talk about a little bit, but the loan, and I know we're bird walking, doesn't pertain to the DMC ODS or SUDT budget. It pertains to the specialty mental health budget, so it's a different budget unit. Thank you.
Go ahead, Supervisor Pyska.
And so, just again, you said that there is no other medication-assisted treatment in the county.
No, that's not accurate.
Oh.
So a lot of the federally qualified health centers will have individual, like your primary care provider could prescribe MAT. Any primary care provider could if they wanted to, given adequate supervision. There used to be a lot more restrictions on which doctors could prescribe MAT medications, and those restrictions have been lifted a couple of years ago to increase access because of the opioid crisis. And so we're actually working to kind of zoom out from a global perspective or a community-wide perspective on MAT treatment. We are working on convening with our other local healthcare providers to get everybody on the same page as about MAT, but individual primary care providers in their comfort level and their practice could do MAT. You walk into an emergency department, you could do MAT. What we offer is MAT combined with outpatient counseling, so intensive outpatient, so it's programmatically based, which works for some people. Some people may participate in that MAT program and feel that they're sustained, and then maybe we transition them, and then their primary care provider, they pick that up. So there's lots of different scenarios, but what it enables us is that level of care for those folks who are needing more support.
Yeah, and we know that the primary care providers are stretched very thin, and it's really difficult to have access to them right now. And so this sounds like a more holistic approach.
That's the idea. It takes a village. We have a lot of great MAT individual prescribers in the community, but having a specialized MAT clinic where it's embedded within a program of outpatient counseling and services is something that hasn't been a strong offering in the county up to date.
Yeah, and if there were Medicaid cuts that would impact this program, we would be able to revisit this contract.
We would have to.
Yep. Okay, thank you.
Vice Chair?
Yeah, I just want to make sure I understand on I guess it's the use agreement you said you're working with council on for?
I have not been, but I am happy to discuss that with admin and council.
Okay, so how would, if we were to approve this, how does that affect we don't have the use agreement yet? Was that
We haven't to
problem,
date. We have business associates agreements. We've done a bit of a risk analysis to ensure that contracted staff are not supervising county employees, that there's sufficient barriers. But we've looked to make sure that they're not acting in any way, shape, or form as a county staff, but we have not ever asked them to pay for the clinic space that they occupy within our clinics because they're providing services to our beneficiaries.
Okay.
All right. Is there anyone from the public that would have any on Zoom? No. I'm going to bring it back to the board.
Mr. Chair, I move that we approve the agreement between County of Lake and Community Behavioral Health for substance use disorder medication assistant treatment services for fiscal year 2025 to 26 in the amount of $1 million and authorize the board chair to sign.
I'll second.
I have a motion to end a second. All in favor?
Aye.
Aye. Any opposed?
Nay.
Motion passes 3-2.